everyone. My name is Simiran Choudhary and I welcome you all on behalf of Voice of Healthcare to a thought-provoking panel discussion on topic that often goes overlooked, but it is absolutely vital to our well-being. Are you really protected? The adult vaccines gap no one talk about. So when we hear the word vaccination, most of us immediately think of children. But what about our adults? The reality is immunity does not last forever. As we age, our vulnerability to infection increases. And yet, adult vaccination remains one of the least discussed and least practiced aspect of healthcare in India. From flu to pneumonia to hepatitis and HPV vaccines are powerful tools to protect lives, reduce complication, and cut healthcare cost. But awareness and uptake remain far too low. And to shed light on this critical aspect, we have with us an eminent panel of experts who will guide us through the science, the gaps, and the solution. I would like to welcome Dr. Prasun Chatterjee, Chief Geriatric Medicine Artemis Hospital, Gurugram. Welcome to our show, sir.
Namaskar. Simranji, thanks for having me in the panel.
Thank you so much for joining, sir. Next, we have Dr. Aakashneel Bhattacharya, Consultant Infectious Disease, Paras Health, Gurugram. Welcome to our show, sir. Thank you so much. Thank you so much for joining, sir. We have Dr. Sana Merchant, Consultant Infectious Specialist at Holy Family Hospital, Mumbai. Welcome to our show, ma'am.
Thank you. Thank you for having me.
Thank you so much for joining, ma'am. And to begin with today's panel discussion, I would like to raise my first question to Dr. Chatterjee. So we know that older adults are often more vulnerable to infections because of their weaker immunity, but we don't even talk much about it. So if you could shed light on which vaccine become most critical in protecting senior citizens and why.
Uh, Simran, thanks for raising this important topic. But even though going to be older, and predominantly 80 plus is the fastest growing population. Their immune system is really, really poor because it's like weak body, weak mind, and weak immune system. And most of the ICU, if you visit, most of the ICU is occupied by 60 plus, 70 plus, and 80 plus due to chest infection, be it flu, be it pneumonia, or it is any other viral infection. COVID has created some amount of buzz. So most of us, and from the push from the government, most of us has received COVID vaccine, including elderly people. But unfortunately, senior citizens don't receive vaccine. If you ask most of the doctors, irrespective of their specialty, starting from primary care physician to super specialist, usually it is not that mandatory things. ऐसे बोलते हैं कि फ्लू शॉट हर साल लेना चाहिए, निमोनिया का टीका ले लोगे तो बड़ा अच्छा है, नया हार्पिस जोस्टर वैक्सीन ले लोगे तो बड़ा अच्छा है. So usually doctor gives an optional case as compared to children. If you don't take this is going to be dangerous for your child. But I'll be unbiased. Although I'm for last 2 decades I'm purely a geriatrician. I don't see any patient who is less than 75. I have 100 plus patient also. I am very, very strong proponent of vaccine, be it flu, be it pneumonia, be it zoster. Pneumonia, flu, definitely most of us know it doesn't stop disease to happen, but it drastically reduce the severity of the disease, which will help you not to go to ICU, because pneumonia in elderly is a very atypically presented disease. Mostly they don't present like young population where there is classical sputum fever, high grade fever, all these things, breathlessness is there. It is not the case for elderly. They may present very, very atypically, and mostly they present to hospital very late. When it is actually late to treat them in room, mostly they go to ICU. So most of the vaccine, be it flu or it is pneumonia, it prevent severity of the disease. Along with that, latest recommendation also suggests for RSV vaccine, which is not very popular in this country, but that is also needed. But I'll highlight about Shingrix vaccine, which is vaccine for zoster. We see lot of patient of herpetic neuralgia related pain which is a really debilitating disease, and patient take 1 to 10 painkiller in multiple format, because in elderly, they have a habit of doctor shopping. For every symptom they go to doctor. So it is expensive. So again, for seniors, a finance matters, be it for him or for his next generation. They're not very keen to spend money until unless it is so again, vaccine for herpes zoster is equally important. Other than that, Tdap and hepatitis B, which is chief, should be given. This 6 to 7 vaccine all elderly should receive. Last point, I would like to mention that in our health behavior, we are not very reactive across the generation. This country is like that. We don't talk about disease until unless we are suffering from that disease. So that is also one of the reasons elderly vaccination has not been popularized. And most of the senior citizen actually till date are getting treated by primary care physician just next door, we call as family physician. So I think sensitization has to be started from family to primary care physician to super specialist. Mostly they reach super specialist in late stage, but there also it is not a mandatory practice in most of the corporate or government hospital. I was in AIMS for 15 years. I tried to start it, but again, finance matters for government also. We in AIMS we give flu intermittently, polysaccharide vaccine we give, but not Prevenar. We couldn't give it free to any of the person.
Thank you so much for that response, and thank you so much for mentioning how we take it very lightly for the adult vaccination when and as compared to when it comes to the child vaccination, because we take it as optional until unless it becomes very severe. So thank you so much for that response, sir. Moving on to my next question to Dr. Aakashneel. So we were talking about the infections and the diseases. So if you could help us understand that which major infections and diseases in adults can be prevented through proper vaccination. So you're on mute, sir. So, so we cannot hear you.
Can you hear me now?
Yes, I can hear you now.
Yes. Thank you. So, uh, can you repeat the first question again?
So which major infections and diseases in adults can be prevented through proper vaccination?
Right. So, I would go by disease severity perspective. Okay. So, there are many vaccines to offer to an adult who comes to our OPD. So, to start with, I would always suggest for all age groups, they should get annual flu shots. So we saw the COVID pandemic and this flu H1N1 and H3N2 influenza vaccines. So this influenza is very lethal. So it might be a upper respiratory tract pathogen, but at times we see very bad pneumonia leading to ARDS. And ARDS is a condition where uh, there is nothing uh, very minimal healthcare options we are having apart from ventilation, mechanical ventilation, and wait for the lung to recover. So it is a vaccine preventable disease spread over world over, and we see cases off and on, and many cases they get complicated. So my first option to someone coming for adult vaccination, I would recommend everyone to get annual flu shots. And the appropriate timing for this flu shot is the pre-monsoon time. So we had many epidemiological studies, mostly done in the northern part of this country. So we see that the pre-monsoon time is the best time to get yourself vaccinated for flu. Coming to the next disease, as Prasun sir has very rightly mentioned about the pneumococcal disease. So this invasive pneumococcal disease, it carries a very high mortality rate. Pneumococcal disease is caused by a bacteria which is called Streptococcus pneumoniae. So which is a very robust bacteria, and which is a very virulent bacteria. It is known to cause pneumonia, but at times we see, oftentimes we see in the elderly population, in the immunocompromised population, and even in the immunocompetent mid-aged persons, we have seen patients, they are first developing pneumonia, then it is going into disseminated infection, which we call invasive pneumococcal disease, pneumonia, meningitis, bloodstream infection, and it carries a very high mortality rate. So there are two vaccines available in the market. One is PCV 13, and one is PCV 13, and the next one is, um, just give me a minute. One vaccine is PCV 13, and another one is PPSB 23. But the good news is that we have a better vaccine than these combinations. It is PCV 20. So it covers 20 serotypes of Streptococcus pneumoniae, the bacteria I am talking about, pneumococcus. So this PCV 20 is a very good vaccine. It is available in India now, approved by all healthcare authorities all over the world. So you can get a shot wherever patients are eligible. It is mostly indicated for patients who are uh, more than 50 years of age, no comorbidities. So everyone should get a shot of this vaccine, lifetime immunity against this disease. And in the younger age group, 18 to 49 years, whoever is having some heart disease, lung disease, chronic diseases, some patients, they have one condition which is called CSF leak. They leak their fluid, brain fluid, which is called CSF, either from the ear or from the nose. So it is a must. This vaccine is a must for those. So I talked about first flu, then pneumococcal disease, then I will talk about hepatitis B. Uh, Now, in today's India, for the very last one decade or two, uh, babies who are born, they get vaccinated as per the national immunization schedule. But if you think about the adult population who are maybe 40 and above, uh, they did not receive this vaccine at birth. And hepatitis B is a very contagious disease, and we have a very high prevalence rate of chronic hepatitis B in our country. And it is completely vaccine preventable. The vaccine is very effective. And hepatitis B is something, when it is this infection go into chronicity, then there is no point of return. Ultimately, the patient will go into cirrhosis. And it is also known to cause hepatocellular carcinoma in case of chronic hepatitis B. So, this is a vaccine which is called, this vaccine can prevent a cancer. Then, if you ask me about the importance of vaccination, so after hepatitis B, I would mention that herpes zoster vaccine, shingles vaccine for elderly. As Sarah has rightly mentioned, it causes so much pain and morbid condition in post-herpetic neuralgia cases, and also in the elderly patients, this zoster can disseminate, and patient may lead to varicella encephalitis, brain infection. So this is a very good vaccine to offer to the elderly adults. And another thing, uh, most important thing, in today's world, it's a migratory world. So no one stays at a same place for a long time. So you have to be very careful being a doctor. For the doctors who are watching, I am telling you, that you have to be very careful about the habitat of of that person. I might be seeing a person in Gurgaon, but I do not know that this person is traveling the whole world. So travel history is very important. The where, which country you are visiting, and in the last 6 months where you were, and what is your next travel plan. So this travel history can guide us to decide on the very important vaccinations. Like someone traveling to uh, Africa, you should tell that person to take a yellow fever vaccination, right? So these are the list is very long. I don't want to prolong this discussion. So these are the major vaccines which are life saving, and travel history is very important to take
Thank
whenever you to offer vaccines to your patients.
Thank you so much, Dr. Bhattacharya, for answering that question and giving us in-depth answer that not all vaccines are important and what all diseases it saves us from. Moving on to Dr. Sana Merchant. Ma'am, I would plan to ask you about the vaccines, but now I would skip that because Dr. Bhattacharya has already answered us that. So I need to understand that if adults skip or delay these kinds of vaccines, what kind of outbreaks or complication we can expect in our community level?
So that's a very good question, and I think it's important for us all to understand the impact of these vaccines on not only us but the protection of the health of the community at large. These infections, which have been so elaborately explained by the previous two speakers, the influenza, the pneumococcus, all of these vaccines are prevention against diseases which are so common. So every monsoon throughout the year, but in monsoon in particular, we see multiple cases of young as well as elderly patients presenting with flu, with pneumonia, and it is such a sad thing to see because it means so many days of good health lost. It takes a hit on the finances. It takes a very long time for recovery. The hospital stay sometimes is very prolonged. There is exposure to various antibiotics, and the community at large loses its days of productivity. And especially for a growing economy like India, it is very important that we preserve the health of our youth. Even in the elderly population, these diseases take a much worse hit in them because, as explained by Dr. Prasun, their immunity is much lower than those of the youngsters, and immunity to childhood vaccines wanes with time. So they have less fighting power against these infections than the youngsters. And because now we are facing a time where our population is more aged than before. We are seeing 80-year-olds, 90-year-olds in our daily practice, and we need to protect these elderly patients from all of these disease conditions. There is so much of life lost, unfortunately, every year due to vaccine preventable diseases. And I think the burden of these infections is really not understood well enough in the community. Protection of multiple members of the community also extends protection to the less immune members of the household. So if enough members of the community are vaccinated, they can actually protect the weaker sections of society, such as very young children, very elderly patients. We are also now seeing increase in the number of patients undergoing complicated treatments such as transplants, such as hematological blood related cancers, such as chemotherapy for various solid organ cancers. These patients are an especially high risk for such infections. And if the community at large is protected from these by vaccinations, we are protecting the weaker sections of our community as well. So, by not getting vaccinated, by not taking these adequate, readily available precautions, we are increasing the days lost due to disability. We are increasing the chances of death amongst our young and our elderly patients. And we are increasing the risk of exposure of these weaker sections of society to much more severe consequences of all of these infections. A simple vaccine can prevent such bad outcomes in so many different groups of patients in our community.
Thank you so much, Dr. Merchant, for that answer. And it really is need. It's important that we vaccinate our adults so that it won't be convert into a bigger outbreak, like you just explained to us. Thank you so much for that response. Moving on to my next question to Dr. Chatterjee. So many elderly patient already manages multiple conditions like diabetes, heart diseases, or lung problems. So how does this vaccination help reduce the severity of infection and prevent the complication in such high risk groups? So can you hear me? So you're on mute, sir.
I'm not muted. Let me try it again. Can you hear me now?
Yes, sir.
So you asked me this question that severity, whether still they can be protected with vaccination. Was that your question?
Yes, sir. Because elderly people have many conditions like diabetes, heart disease, lung problems. So, how does this vaccination help reduce the severity of infection and prevent complication in high risk group people?
Actually, someone who has more disease, he or she has more chance to be immunologically more compromised. That means internal protection, internal power to fight with the bacteria or virus is further less. And any form of chronic non-communicable disease like diabetes, chronic kidney disease, those who are suffering from HIV, tuberculosis, these kinds of chronic non-communicable disease or infectious disease like HIV as tuberculosis, as I mentioned, that makes the person more vulnerable for infection and infection-related complication. So, if I give an example, let's say someone is suffering from incompletely treated or uncontrolled diabetes for last 20 years, 80 years person, and a 80-year person without diabetes. So someone who has diabetes poorly controlled for last 20 years is more prone to catch infection and infection related complication. So they are actually most important candidate, and they must be given vaccine so that their vulnerability towards infection get reduced. Along with that, their severity of infection get reduced. So more the disease, more you need the vaccine. Even end stage renal disease, we call as CKD stage 4 and 5, chronic kidney disease stage 4 and 5, they are more prone for infection. They are more prone for frailty. We call it as frailty syndrome. Like functionally, they are very weak. All of them need vaccine, and all form of vaccine what we are already discussing. And न्यूमोनिया को तो ओल्ड मैन का फ्रेंड बोला जाता है. मोस्ट ऑफ द पीपल का one of the exit point from the planet is pneumonia, but no one likes to die in ICU under ventilatory support. So we have seen many studies. There are multiple evidence, what we call as evidence, has been generated, which shows that severity of pneumonia can be drastically reduced with the pneumonia in vaccination. So there are polysaccharide vaccine, there are protein vaccine, Prevener, what we call, but you have to get vaccinated for that, and they are all studies has been we call as randomized control trial, which has shown yes, they are effective to reduce infection and severity for immunocompromised patients. So immunocompromised का मतलब ही यही होता है, either multiple disease has made them immunocompromised or extreme aging 90 100, they have become immunocompromised, just like old car has the most of the parts has become weakened.
Understood, sir. And thank you so much for beautifully explaining us to that and what the complication, how severe it can lead to, and how important it is for the such high risk people to take vaccination on time, and how it can reduce their severity. So thank you so much for that answer. My next question is Dr. Aakashneel. So, what is the difference between vaccines that are essential for adults as compared to those needed only for the high risk group people. So you're on mute, sir.
Uh, so for all the adult population, so I can enumerate a few vaccines which everyone should take, starting from the flu shots annually, then the your COVID booster, which has been recommended by all global authorities. So I mentioned it on the second spot. Then diphtheria, tetanus, and pertussis booster every 10 years. If not vaccinated against MMR in the childhood, we have blood tests to identify if someone is having antibodies towards these infections or not. Mumps, measles, rubella. So if they are not vaccinated, or your blood test is showing no protective antibodies, then MMR vaccination. Chickenpox vaccination, which is called varicella. Nowadays, many children they get vaccinated, but in the adult population in our country, very few are vaccinated. Then comes shingles vaccine, which is a very painful condition. And one thing to remember that both of these infections, chickenpox and shingles, this is caused by the same virus. But shingle vaccine, it doesn't protect you from the chickenpox infection. So both the vaccines are essential. Then HPV, human papilloma virus. So previously it was taught to us that before the age of uh, uh, 26 in females, now in countries, in many countries, the age limit is it is going up, and till 45 years of age, this human papilloma virus vaccine, HPV vaccine, can be given. This is a very important vaccine for the females, as there is one cancer which is called cervical cancer. So cervical cancer is caused by this virus HPV. So this vaccination can prevent a very serious cancer in females. And lastly, in the routine format, I would say if there is any of the risk factors, even smokers, smoking is a risk factor for pneumococcal infection. So the PCV one, PCV 20. These are the normal vaccines we offer to normal adults. But your question is, what is the difference between the normal vaccines and the vaccines we give to the high risk groups? So now I have to define the high risk groups. Who are the high risk patients? So, firstly, the high risk groups who are immunocompromised. Someone going for a bone marrow transplant, someone is under immunosuppressive drugs for some autoimmune conditions, someone with a solid organ transplant with immunosuppressed condition. Uh, then I would say someone undergoing chemotherapy. So we have to be very cautious in these patients, just not to vaccinate them on a blanket manner when your immunity is very low. So we try to avoid live vaccines. So now comes the question: what is live vaccines? So there are different type of vaccines, like uh, uh, the very classical example is polio vaccine. There are two types of polio vaccine available. One is oral polio vaccine, one is injectable. So the oral polio vaccine is the live vaccine. So where that the polio virus is present in the vaccine, but the virus is not virulent. So we cut it off its virulence, but when you are someone is taking that vaccine orally, that weakened virus is able to produce immunity in our body, which is called antibody production or immunogenicity. So these are the live vaccines. Even rabies vaccine is a live vaccine. Another vaccines which are killed vaccines. Killed vaccine means like we are talking about pneumococcal vaccines. So pneumococcal polysaccharide that is conjugated with a protein. So there is no viability in this vaccine. There is no live bacteria present in this vaccine. Just like I mentioned, how oral polio vaccine and rabies vaccine contains a live virus, but they are not able to cause any disease in the immunocompetent individuals. But whenever someone is immunocompromised, we should be very careful regarding these live vaccines. So, as they are live, with weakened virulence, weakened ability to attack an individual, but somehow these live vaccines can be life-threatening in the immunocompromised, severely immunocompromised populations. So, live vaccines should be avoided. This is the first point. Second is these high risk groups. Uh, you can tell me what high. Just in your previous question, I told you that frequent travelers, they are high risk groups. They are high risk to catch infections. Someone came from US to work in Gurugram in a corporate office. Uh, there is high chance of getting malaria, as this person was not exposed to this malarial parasite before. So malarial vaccine is underway. It will roll into the market, I think, very soon. So this is just an example that the travel history is very important. Where you are going, where you are mixing up with people, are you a healthcare worker? Next, coming to high risk groups with comorbidities, like someone with chronic liver disease, stable chronic liver disease, no history of decompensation. Decompensation means fluid accumulation in body, drowsiness, bleeding, never happen. So, hepatitis B vaccination and hepatitis A vaccination is mandatory. So, we generally do not offer hepatitis A vaccination in Indian adults, as many of them they develop immunity against this virus in the child. But whoever is having chronic liver disease, you should give them hepatitis A shots. As a single episode of hepatitis A infection, which can be very much manageable at home for any normal person, in a patient with liver disease, that can be life threatening. So now, high risk groups, another high risk group, I would say, uh, who are staying in some institutions. So there are few diseases which are known to cause institutional outbreaks, like meningococcus. Meningococcus is a bacteria which causes meningitis. So uh, in our country, some institutes, and in the developed world, all the institutes where you are going to study, you should be vaccinated against meningococcus. This is a bacteria, very lethal bacteria, can cause meningitis associated with multi-organ failure. Another vaccine for the institutional to prevent institutional outbreaks, that is Haemophilus influenzae. This bacteria is known to cause meningitis as well as pneumonia. So, if I talk about these high risk groups, so the discussion will go on and on. So, these are the major things I wanted to highlight to answer your question.
Thank you for that answer, sir, and
Uh,
differentiating what are.
Simran, can you hear me?
So I can hear you.
I just like to mention one point here after Dr. Bhattacharya has mentioned, because um, I don't want to confuse any of the physician or primary care physician or even any elderly people or their family member. None of the elderly vaccines are live what we have prescribed. So please don't be confused with that. And if you have a parents or grandparents, or if you have a patient who are elderly with multimorbidity, high risk group, neither Prevener nor Singrix. We have mentioned about influenza, that is every year. Then Prevener or Nimovac, Singrix, which is a new vaccine for herpes zoster, RSV vaccine, Tdap. None of them are live vaccine. So you can give any of the vaccine to your elderly people who are high risk, who have all form of morbidity, even if they are severe frail, please give them this vaccine. I'm sorry, Dr. Bhattacharya, I just mentioned because many times people pick it this way and then they get confused ki bhai lena hai ki nahi lena hai. So elderly vaccine, I will talk only about elderly because that is my only business. I will not talk about any other population. So especially 80 plus, which is the fastest growing. Even new studies has come. Singrix prevent dementia also. There are a lot of trials are going on. So please give vaccine to the elderly people. Don't worry about multimorbidity and their immune status. Yeah, you can go on. And sorry for the in between interruption. I thought because
Thank you.
that should be
Thank,
crisp for the people. Yeah.
thank you so much, sir. That was a
Mm.
very important point to add on. Thank you, sir.
Thank you so much, Dr. Prasun, for clarifying that thing. And there's no problem. You are here for the expert advice. You can definitely intervene in this. Thank you so much, Dr. Bhattacharya, for explaining us the difference of the vaccines, which we can give to high risk patients and to the normal adult people. My next question is to Dr. Merchant. Ma'am, how can hospitals and doctors integrate adult vaccination into routine checkups and preventive care so it becomes a natural part of adult healthcare? Like in the starting, Dr. Chatterjee said that whenever they go to their general physician or the family physician, they said, you can take this, you can take that, and everything. But it has never been mandatory from the healthcare side to the patients, from few of the physician side to the patients. And how can we make it compulsory like we do this for the pediatric vaccinations basically?
Yes, I think that's something that's very important is to raise awareness. The vaccines, as Dr. Prasun said, are quite feared, unfortunately, amongst the majority of the population. And our job as healthcare workers is to take away that fear and demonstrate the benefits of the vaccinations. So, as we now know, the healthcare community is very well aware of the various benefits of these vaccinations and how far they can go in preventing death and disability amongst various sections of our population. And we should take this opportunity with every patient at every contact to make it known to them. So, whenever there is a patient who sees us in the clinics, who gets admitted under us, at each contact point with the patient, it is our duty to take an assessment of their vaccination till date and advise them on the vaccinations that should be taken in the future. So, if a diabetic patient is coming to you for a refilling of their prescription, you need to ask him that have you taken these particular vaccines, and if not, then schedule an appointment for them to take the vaccinations. If there is somebody who has been admitted with a pneumonia or a chest infection, it is our duty to educate them that there are vaccines available to prevent these conditions in them and their family members and the community at large, and give them the right time for vaccination after recovery from their acute spell of the illness. So at every point of contact, be it within the hospital during a hospitalization or in the outpatient department, at every contact the doctor has to take an update from the patient regarding their vaccination status and advise them on what vaccines they should be taking ahead. Secondly, I think every staff member of the hospital also should be educated and aware so that the sisters who are sometimes in much longer touch and much more intimate touch sometimes with these patients can also be one of the modes of communication from the healthcare community to the patient regarding the status and the importance of their vaccination. I also think that a lot of hospitals now have got vaccination clinics, which are dedicated centers just for the purpose of vaccination. And that helps because if a patient comes to you, you have counseled them regarding vaccination and they have expressed an interest in taking that vaccine. We should offer on the spot vaccination. We should be able to offer those services in most of our hospitals and our clinics, so that we can take advantage of this. And the patients probably, they wouldn't like it if they have to make multiple special visits or go, take certain specific steps to get these vaccines. So if they are freely available at most hospitals and outpatient departments, that will become an easier process for the patients and the healthcare workers. We can also use our electronic health systems now. SMSs and emails are a commonplace everywhere. We get our reports by email, we get our prescriptions sometimes by email. Our healthcare systems are all on the computers, so we can use this to give reminders to patients about their pending vaccination, especially the vaccines which are two doses or they require boosters. The reminders can go out to these patients. Along with every prescription of theirs, there can be a reminder message to get their vaccinations done. In our OPDs also, we can have pamphlets, we can have awareness posters about the importance of vaccination, about the availability of vaccines, and what kind of illnesses they protect against. And I think last but not the least, success stories are important to share. So the patients who have got vaccinated, who have got the benefits of these vaccines, they are the best people to convince other people to take these vaccines. And we should use these recordings, or we should use messages from them to convince other members of the community about the usefulness of these vaccines.
Very, very rightly said, ma'am. And we need these kind of coverage from our healthcare fraternity, from our governments and policy side, so that we can make it an impactful initiative, an impactful step, and a mandatory step. Like the vaccination drive we saw during the COVID time, that was amazing. I think there was the digital records kept. It was the messages were going on. The reminders were there. Now it's time to take the second dose and everything. If we can do the same for the adult vaccination, or the way parents keep track of their child's vaccines, if the families can do the same along with the hospital, they can share the messages, now it's time for this dose and everything. So I think we can do a lot much better than what we are doing right now. So thank you so much for
Yes,
that.
there's a lot of room for improvement.
Yes. My next question is to Dr. Chatterjee. So, we often see that families focus on medication and treatment but ignore the preventive measures like vaccination. So, what role should caregivers and family member play in making that vaccination part of their healthy aging?
Uh, no, Simran, as previously also I was discussing, because I'm also working with longevity. We are doing a 0 to 100 years follow up how people age. You know, so the problem is we are still till that the medicine is more of not proactive. We treat only a disease when disease is full fledged, when the patient suffers, then only we bring them to hospital. अभी भी मुझे लगता है बहुत ही कम परसेंटेज लोग एनुअल हेल्थ चेकअप के लिए भी जाते हैं. सो हमारे ओवरऑल अवेयरनेस में I'm going to hospital and taking vaccine, so that is the reason even covid के लिए भी vaccination center खोला गया था जगह जगह पे. So the concept is again, I think Dr. Sana has mentioned most of the point, that the awareness has to be from various level. It can be first it should start from policy level, then macro level would be most of the hospital, be it private, be it government. Then comes the family member who are the primary caregiver, or whose near and dear one is an elderly person. Again, I'm talking about only elderly people, but you have to also consider about the finance. It's like you can think of one way, it's like medical insurance. When अभी भी हमारा देश में बहुत ही कम परसेंटेज लोगों को इंश्योरेंस होता है, until unless it is mandatory from your job place. So we consider every year I am spending 30,000, 40,000, 50,000, but I don't have any disease, so why should I? So that is the concept many people don't take. It's not mandatory like United States that you have to have insurance, otherwise you will not get any treatment anywhere. So same is for vaccination. So vaccination, if I combine all 5 or 6 what we I recommend for all my patient, it will cost around 20,000 plus, which for many people it may come as it is too much. Why should I spend this? जब बीमारी होगा तब देखा जाएगा. So these kinds of awareness, like attitude, which is more of uh, reactive attitude. We are not proactive for our health. If I give a small example, forget about vaccine. How many of us, including even this 3 of us in panel, how many of us exercise daily? So exercise is also is better than vaccine, right? But
Correct.
how many of us exercise? Even if we are preaching, how many of us exercise? The question is, again, I'm a geriatrician. um, uh, I couldn't give my parents till that Singrix. They are 70 plus. So accepting that is very easy to preach, but when it comes to practice, taking them only for vaccination to a hospital is not a easy task. So
Yeah.
convincing family member from financial point of view, but yes, if I'm able to convince them, look, today's 20,000 will be tomorrow's, it may reach up to 20 lakhs. Most of the corporate hospital per day ICU cost is 1 lakh plus. So if someone goes to ventilator and stay in ventilator for 10 days, so you are going to spend 10 lakh plus money, whereas probably you could have avoided that spending 20,000 rupees. So our overall attitude and approach is not right. But yes, if it comes from policy making, I think government needs to work much more, because government has allocated 5 lakhs money for 70 plus people through Ayushman Bharat program. That program should incorporate that every elderly should get vaccinated with X amount of money, you know. uh, when I was in AIMS, I tried to do that, but yes, we will pursue that further. And government needs to, so when it is in policy level, and if elderlies are very happy to get free things, you know, so if it comes like free, then people will consider. Just like COVID vaccine, COVID was free, but till date most of the vaccines are not free, rather very expensive. The new version whatever is coming. So I would say finance matters a lot, but uh, yes, it is our role as a care provider, as a next generation, to save our near and dear one at least. If vaccine can prevent that, we should prevent that. So yes, awareness is the only option to explain them.
Very, very rightly said, sir, that awareness is the only option to prevent any of the other health disease, which it can prevent or it can lead to more severity. And like Dr. Bhattacharya and Dr. Merchant also stressed upon few of the vaccines and how it can change the scenario if not given on time. Like you said, sir, it is not easy to take our parents, especially for the vaccine. And that awareness is not there. Even if I have to ask that someday or the other day, if I have to take my parents, first of all, I need to get that awareness. Secondly, I can take them to the hospital. I think that is the biggest step, the challenge. We have to fill that gap. I think that can only be done through awareness and that basic education we need to provide as we have for the pediatric vaccination. Uh, I would like to conclude this session now, and I would like to thank each of the panelists present here for sharing their insights, views, and expertise, and stressing upon this important need as of now, as India is aging. I believe population, most of the population are younger age, and now they'll be at most of the generation will reach to an older age at the very same point of time. And thank you so much for all the insights and expertise you have shared and the time you have given for this important session. Thank you so much.
Thank you all, and having us here and raising this issue. Yeah, bye.
Thank you.
Thank you so much.
Okay.